I'm looking at the Royal Commission into Mental Health of Victoria, the questionnaire that people are given with their formal submission that needs to be in the 7th of July. Now, I've already looked at question 1, which is offensive. You just shouldn't be able to say that. But question 2 here, what we've got is what is already working well and what can be done better to prevent mental illness, once again they're using that word, to support people to get early treatment and support. Now, isn't that just a white coat, white out question? It is just set up for those people in the industry so they can just say, blah, 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 our buy-in is this, give us a percentage of the money that they want to grab that's out there. That's not a Royal Commission. That's a setup for a money grab. That's an industry money grab. So here's where victims of psychiatrists, people who've been through for psychiatry like myself, and people who are still having to find some way to get free from forced psychiatry, or having a threat of it, imminent threat of it, having them knock on the door and drag them off again. They look at a question like that, saying what is working well? What is working around about the mental health system in Victoria? Working well for who? Working well to get white coats wealthy, but it is destroying those people who are being exploited, who white coats are claiming to help and care about. Absolutely destroying, because it is an exploitation racket. You cannot improve an exploitation racket unless you are prepared to be called an absolutely vile, disgusting dictator. Get that across to them. Because this question is really wrong. You just can't ask questions like this and expect people not to be upset when they've been put through this. What can be better done to... Here you're trying to even set people up to say that they have to go to those thugs early on. So get them when they're 8, and then suddenly you've got a person for the rest of their life, they're just suddenly a laboratory specimen. Well, I'm very happy they didn't give me an 8. I at least had my childhood. Some people are not. They've had their entire childhood taken away and their adulthood. I've known people who've been locked up at age 11 when it should have been some adult that was committing a crime, or the psychiatrist that was perpetrating against them that should have been put away. So many people trying to speak out against violations that are happening in society, and then psychiatrists drag them off, silence them, cover it up. Now, this is not a system that should perpetuate. It is a system that needs to be abolished. The mental health system of Victoria needs to be abolished. The Mental Health Association worldwide needs to be abolished. It's a eugenics-based organisation. We don't want it. Of course we don't want it. It's vile, it's cruel, it's exploitation. You can have a system of exploitation and improve upon it unless you're totally evil. Now, that's how that question makes a victim of psychiatrists feel. And they have more questions like that. They've got a set of 10 questions. So that's question number 2.